where we have patients who shall have covered large amounts and those that have been covered in very small amounts. So they keep on wondering. This guy was paid, the patient was paid, bill was paid to an extent of 300,000. There's this one who is requesting only 15,000. It is not being paid. So there's one thing that the cabinet secretary and his team must come out and tell the public. Continuous communication about what is covered by what to what extent. And lastly, Mr. Speaker, during this public participation that we had with our people, there are those who still want even to be told to be taken through on how to register, and they want to register, they still don't know how. And your medium of communication cannot rely on TV and newspapers only. Nowadays we have so much. You're even talking about AI being used now in the medical space. We have these influencers. We have these social media spaces that we need to have this communication go out again and again so that we demystify this thing about SHA. It is working, yes, but you get to a point where you have to still have to explain to people, Mr. Speaker. Cabinet
Speaker, the cabinet secretary needs to come out, as my colleagues have said, very clear on what SHA covers and what SHA does not cover. And I want to go on record, Honorable Speaker, my own mother stayed in hospital for 5 days, and SHA, out of her bill 213,272, SHA only paid 11,740. Honorable Speaker, Cabinet Secretary, what's not happening? Surely something is not being truthful. We are not telling the Kenyans the truth on what SHA can and what SHA cannot do. NHI probably needs to pay better than this. We just need that comfort. Communicate very clearly, and the evidence is here. Hospital bill is here.
KIBANGENDI.
Thank you, Honorable Speaker. First, I would like to be very clear that the CS is talking about an ideal situation. That is not what is happening on the ground. Just like Honorable Oundo, my mom has been sick for close to 10 years now. In 2019, she was operated on. It is called diabetic foot. And the bill then came to about 625,000. NHIF paid 270 or thereabout. On Saturday, the bill for my mom, who has been ailing again and had to undergo 2 operations at Metropolitan Hospital in Buruburu because of diabetes, the bill came to 1.1 million shillings, and the bill that was paid by SHA is 123,000 shillings. I shared that with my chairman, and we shared that with the hospital. And Honorable Speaker, today I'm trying to control myself so that I don't demonstrate the unfortunate thing that happened the other day. What I would like to assure you, Honorable Speaker, is that nobody in this country has done research on SHA like I have. Number one, on issues to do with benefits. The benefits in SHA are inferior to what NHIF was offering. That is one. Number two, the processes of reimbursing hospitals is systematically oppressive to hospitals in the sense that hospitals now are too careful on how they handle patients. Number three, professionalism within the ministry, SHA, and every other space within the Ministry of Health, Honorable Speaker, we have trouble. And this is happening, including up to the counties. And at this point, Honorable Speaker, I would like to request the Honorable Cabinet Secretary, when people raise concerns, please don't politicize these concerns. Seek to have proper interventions for these concerns. Thank you, Honorable Speaker.
Didymus.
Thank you, Mr. Speaker. I want the minister to confirm two questions. Number one is during means testing that those Kenyans who are perceived to have some stable source of income will pay more than those who do not have, so that we can be able to understand why KIBANGENDI's mother, NHIF, paid more than what SHA is paying her. If that clarification is done, then we can understand that in terms of means testing, the amount you pay is dependent on your perceived income. Number two, can the minister confirm to this House, because any new policy that the government implements must either generate into some small public problems, because it is new. You may think you are solving one, then 3 or 4 comes up. So can the minister confirm to this House that in his ministry, he has set up a team that will entail in collecting data, collecting those problems that are coming in implementing this SHA and SHIF, and that they are working around the clock to ensure that those problems don't recur again, because policy improvements are done by using feedback as a tool for continuous improvement. Can the minister confirm to this House that indeed Kenyans should be confident that SHA and SHIF will continue to improve because they are collecting data which they use as a tool for continuous improvement? I thank you, Chair. Yes.
Thank you, Mr. Speaker. Mine is just to ask the CS whether the ministry has ever done what I'll say, just go and do your tour to different hospitals, sample out, and get to learn what is the biggest challenge that we are facing as a country. Because when you hear the prices we are paying in hospital, I'll give you an example, CS. I know SHA doesn't really cover so much on patients of diabetes. And we find a hospital, just the normal testing of diabetes, on the fee that they are charging is 700 per test when a patient is admitted in their hospitals. I will tell you today, I am discharging my mom. If I give you the figure we are paying for 1 week, 4 days, 3 million, doesn't make sense. Yusuf was here, the brother passed on 2 days ago. Stayed 4 weeks in Aga Khan, 11 million shillings. 200,000 was the dialysis test every time. We need now to come with a cap, and I want CS to look at it. Either you tell us the taxes on issues of health are so high that the hospitals should be charging this, or we bring a cap and we decide as a country, this is where a hospital can reach. If it is management, take a patient the way they do in the US to a management care hospice for Kenyans are going to go to the worst in this health system. Thank you.
Nabulindo.
Thank you, Mr. Speaker. Mine is very specific, and I would like to talk to Waziri. Waziri came to Mumias 2 months ago and had negotiations with our Bishop Kakamega, over St. Mary's Hospital, Mumias. And on that day, the CS announced publicly that St. Mary's Hospital is going to be opened the next day. Mr. Speaker, I would like to inform the House and the CS, if he's not aware, that St. Mary's Hospital is yet to be opened. The people who are getting services at St. Mary's are still suffering. And St. Mary's, this is an institution that was opened 1930. It has a lot of significance in Wangaland, and all of us have grown up using St. Mary's Hospital. In fact, several of my children have been born in St. Mary's Hospital, and another one will be born there next year if it will be open. So could the minister...
You are a very hard-working man.
Yes, I'm sure next year Mama will go there to get a baby. But the hospital is not open. So what will happen? So could Waziri tell us what is actually going on about St. Mary's Hospital? People are really suffering. Thank you, Mr. Speaker, and thank you for the chance.
Robert.
Thank you, Mr. Speaker. You know, NHIF had a very, very bad reputation, and due to its poor management of claims, and the CS has constantly made, mentioned that. But CS, when now you started deducting more money under the new arrangement of SHA, with a system that cost us 104 billion over a 10-year period, we thought that this issue of fake claims and this management of claims would be a thing of the past. Now, recently in a public baraza, you actually were saying that there's a lot of money stolen through the new system, and that you are actually going to take some cases to the DCI. I wanted to just know, does that mean that this new expensive system is not working? And so far, after you took your files to DCI, how many have been convicted and jailed? Thank you.
Honorable Speaker, let me start from the reverse. From my former colleague at Moi Forces Academy, many years, the deputy minority leader. Number one, the system does not cost 104 billion over a period of 10 years. And the government of Kenya is not paying a cent. Because the 104 billion should have passed through this house. So what is there is a fee for service. The system is built, and the Kenyans who use through the Digital Health Agency, then the developers of the system will be paid. Two, and very important, that you have raised. In fact, the fraudulent claims and the facilities that were flagged off, number one, were flagged off by the AI system, fraud detection system of the digital superhighway, and then counter-checked by our clinical review team. As I said, Honorable Speaker, before I came to the ministry, and the SHA is just now 13 months old, the people who used to steal from NHIF went to SHA not knowing that this is a different animal. Honorable Speaker, you'll find a facility saying that there were 300 deliveries in their hospital, and all of them were C-section. That's even against the WHO rule. That is now a fraud. Or there are no birth certification. Then the system says, the system will check the documentation, or there is no even the legal document of the claim. So the system is the one that, and we submitted close to 118 files to the DCI with concrete evidence. I think up to about 20 plus he has submitted to the DPP. Once it has left me, it has gone to a different group called the criminal justice system. Some of them have been taken to court, very senior people in SHA, facility owners. And we will continue. And we have closed 184. I mean 1,184. And they are about, all of them, they're under investigation. So it is, and this fraud, same fraud is taking place in the medical insurance, private medical insurance scheme, even covered by Parliament. If you talk to Jubilee, if you talk to CIC, talk to them. The same problem SHA is facing is what they are facing. Because we had a meeting with them. In fact, today, if SHA suspends you from their portal, I can assure you 100% that facility, all other private medical insurers will also suspend. Honorable Speaker, there were a number of questions. And you know the first one, let me start with the Honorable Tandaza. I want to assure you that I have the list of all the NGCDF payments available. The list also contained receipts and dates and months. And Honorable Speaker, to be honest to the House, I will table that next Tuesday. I'll make sure the leader of majority tables. I kind of want to assure you, and just to give you a sample, Subukia constituency, between 2024 to 2025, the amount is 156,000. Jomvu, NGCDF, 9,960,000. Chuka Eganga Ngombe, 2,700,000. Mandera West, 3 million. Westlands, 966,000, among many others. And I'll table it to the House. And I stand by that. Before the House goes on recess, we will do all the reconciliation. It's now underway, and we will post the reconciliation indigent list submitted during the NHIF time. We will submit to the House, and we will do it through mean testing, and we will make sure that we abide by the direction of colleague members. Honorable colleague members, from Honorable member for Budalangi, my good friend. In fact, between NHIF and the NSSF, the NHIF and SHA, you should be a very happy member of parliament, like me, as a minister. It's SHA that covers more than 4 women. You have 4 spouses. NHIF used to cover only 1. SHA covers unlimited number of children, as long as you can prove they are your children. So that alone tells you that NHIF and SHA, you can't compare the two. To me, Honorable Speaker, the package, the benefit package.
Yes, Angela, what is it?
I never asked how many wives does SHA cover. My question was...
Order, Angela. It is public notoriety that you have been proclaiming how many wives you have.
But I didn't say how many they should cover. He should answer my question. He should go back and answer my question.
Okay.
That nobody chooses which type of disease, the type of, whether expensive disease or cheap disease. So what we are saying is that SHA should cover everything once somebody is sick. Because it guarantees that.
Honorable Speaker, I have been with him for many years in this House. You can see, even when he's asking, he's a very happy man. So he's very happy with my answer that this is a better package. But Honorable Speaker, the benefit package is gazetted and is available. The package was passed by this House. How much is for oncology? How much is for dialysis? How much is for... And if the House, through its wisdom, increases the package, we will. But the package was passed by this House. The package under law is due for review by the Health Benefit and Advisory Panel. And I've taken the concerns of Parliament, and Parliament should also provide the budget. But Honorable Speaker, let me even go a different way. Because many members were asking the differences between NHIF and SHA. For surgical tariffs, across all providers, any surgery, they are unstandardized across all the providers. Before you could go to a private hospital, they charge you a different amount that is charged in the faith-based, that is paid for in the private. But now we have said any surgical procedure, whether it's you go to Aga Khan, or you go to a county hospital, or you go to a faith-based hospital, it is standard. 2, the tariff limits have been increased by 12% under SHA. And I want members to look at even the law we have passed. Every tariff, every benefit tariff have been increased by 12%. Under NHIF, the limits were different for different facilities. Different hospitals were charging differently. And Honorable Mama Degorot, Beatrice, let me agree with you. Healthcare is very expensive. And it depends on which hospital you choose. So you must be very careful which hospital you take your patient to. There are hospitals, private hospitals in our country, that if you stay for 5 days, you get a bill of 11 million, when it should be 2 million. I have concerns. So I think in previous parliament, we have discussed the cost of healthcare in our country. Before this House, Honorable Speaker, my committee, led by Honorable Dr. Nyikal, is looking at quality care and patient safety bill. I think we must do amendments to that law to deal with the cost of healthcare in our country. In other professions, lawyers, their costs are regulated. We must regulate as a country. I'm sure those who are doctors who are in this house and the ones who work with me will not be very happy, but we have to say it. The difference between NHIF and SHA, emergency evacuation will soon be launched. There is the ECCIF. Once we do the emergency evacuation, the ambulance will be paid for by SHA. The first 24 hours will be paid by SHA. That never used to happen under NHIF. All Kenyans now will have an access to an ambulance. The days when a patient is taken to a hospital on an emergency and you are asked for deposit is over with Social Health Authority. These are the benefits. SHA will pay for the ambulance. SHA will pay for the first 24 hours. The only package that I think the feedback we got, and we get a lot of feedback. We have a call center, 147, that every day over 5,000 to 10,000 Kenyans call. We get feedback from leaders like you. We get feedback from citizens on their concerns. But the Social Health Authority, the Social Health Insurance Act, the Primary Health Act. Let me tell you the biggest difference between NHIF and SHA. And this is now where I should want to thank this House and the leadership of this country. Primary health care paid by the Exchequer at level 2, level 3 and sub-county hospital is free. You walk in, you walk out. Now let me come to the question of my sister, Samburu West. Yes, if you ask me, if you put a question on those who are co-charging, I will provide. But I think complimenting the ones who are doing good work, I think I'll do it. You know, it's members who oversight. Mine is implementation. But I agree with you. It is criminal, it is unethical, it is immoral for when this House has appropriated resources for Kenyans who access outpatient through the primary health care fund. And the money is supposed to go to the facility as capitation. You're asking Kenyans to buy exercise book, to pay for laboratory. Mr. Speaker, that is immoral, it's a constitutional criminal even in the law that you have passed. And I think a time will come when we shall shame those facilities and in those counties, whether even my referral hospital, if they charge extra than what is provided. On St. Mary's, Honorable Speaker, even if I was a resident of Kakamega, maybe my children also could have been born there. But let me make it very clear, Honorable Speaker, I've even given you the data as one of our leaders. St. Mary to date, SHA has paid 114,548,896. The claims which are with us, which we will pay in November, which is this month, is only 5.5 million. I went to Kakamega myself. I sat with the whole team, our Lord Bishop. We sat with the whole team, the bankers, the SHA team. We reconciled. We did a press conference. But that is a faith-based facility. I cannot go and open it. Now that I have given you the amount of money, the one for NHIF is a legacy debt, just like Consolata Madari Hospital. Honorable Speaker, St. Mary has become a political hospital. I cannot go and open. I am ready to go with you. But I told the Lord Bishop, when you're opening, call me. I'll even bring extra drugs from the Ministry of Health. We're waiting for the day to be opened. So let me send my good brother, please. 114 million have been paid by SHA. 5.5 he will pay. The reason why it's not being opened is beyond my control. It's the way if Nairobi Hospital today closes, and I have paid them the money, and maybe they want to go and open a hotel, there's very little I can do. Honorable Speaker, so St. Mary, that is the case, but we are, as a Minister of Health, we are working, and I really want to ask both Professor Undo and my brother KIBANGENDI that I need to get the details of those two patients and see those particular hospitals. We have hospitals that also want to co-charge people. They don't want to use the right tariff. It's called decoding. But I'll ask Mercy and myself, Honorable KIBANGENDI and the professor, just share with me so that we check from the system, and if we feel there is a problem, we will go resolve it. It's part of the feedback we want. But we are working on to reduce the cost of healthcare. Number one, by introducing reforms in the KEMSA, making sure we do bulk procurement to reduce the price of drugs. We want to do contract manufacturing. We want to do strategic purchasing by SHA. And that's why we also introduced the next program where hospitals don't need to pay for equipment, neither the county or the national government. Vendors bring their equipment, they put it there. The number of Kenyans who use that, then SHA will reimburse those vendors based on the number of patients that go through. Honorable Speaker, on Mheshimiwa JALANGO, in the journey of UHC, countries must make a choice. And I think he has left. Yeah. The choice is, if this House decides to say that we make healthcare free, then we have no problem. We will just create for you the budget. Now the amount we are spending on ECCIF, the amount this House has allocated, it's in its wisdom for PHC, is huge. So if we say that we share, but that's why we cap the chief payments on the income, that we pay more those of us who are at the apex, so that other Kenyans can benefit. And the principal goal is to reduce those ailments which are very catastrophic health expenditure, like cancer, like dialysis. Today, Kenyans can access dialysis, particularly majority who do twice a week. They are fully paid by SHA. You can walk to Aga Khan, and Honorable Speaker, we are opening a new center called East Africa Dialysis Center soon that will operate 24 hours, where even public servants can work during the day and they do their dialysis during the night. The drivers of this dangerous health expenditure, they include surgical packages and oncology. Maybe we need to look at those ones and see as a country what we can do. Honorable Speaker, I think finally the choice of a hospital will also decide the hospital bill. There are certain hospitals, and I want to make it very clear, that they want to make money. You go to some of them, they have got, they charge you the TV, they have a private wing, they charge you their insurance. All those is lumped into the cost of healthcare. So if you go to a private wing of Nairobi Hospital, you'll pay more. But if you go to the private wing of Kenyatta National Hospital with more consultants, better. And I've seen many leaders now are going to Kenyatta Hospital and Kenyatta University Hospital, MTRH. If you go to those referral hospitals, public referral hospitals, you can get, even if you compare even the private, Aga Khan versus Nairobi West versus Nairobi, do your own analysis. So it depends on the choice of the hospital. But we have done an analysis and we have found out that surgical expenses are the drivers of healthcare costs in our country. And Honorable KIBANGENDI, I can assure you that we will not politicize, but we will just want to give the country the the true situation, and we get a lot of feedback. One, in our call center run by Safaricom and Digital Health Agency, the number and the questions Kenyans ask are close to between 5,000 to 10,000 every day. Even now you can call. Total cost of the benefit package that was financed purely from the exchequer, if we have to say that healthcare will be free in our country, will be close to about 410 billion shillings per year. I mean, that is the reality. And the bed rebate, if you go to level 4, finally, Honorable Speaker, if you go to level 4, the bed rebate is 336. If you go to level 5, it's 392. If you go to level 6, it's 448. 50% of that is an increase from the previous NHIF. Thank you, Honorable Speaker.
Thank you, Honorable Speaker, and thank you, CS. For every information, myself, just like all other members, believe in SHA. But then, there are the small health centers in the village, which really assist the people on a daily basis. In my constituency, there are many of them. We have a Sirulo, we have a Musire, we have a Matsuli, we have many of them, including a Lukongo. And I'm one of the people who often gets feedback to the minister. Honorable Speaker, they have never received any SHA monies. And their SHA monies, because they come and talk to me, are small, but they have never received, like a Sirulo, a Matsuli. So they are really surviving. Yet these are the first places where the patients go to in the village. And the village setup is a very difficult setup. Could you speak on this? That why would it happen that since you began, the small health centers have not received? And I'll be more than willing to give you the full list before you go away. Thank you, Honorable Speaker.
Honorable Speaker, if I'm given the list like St. Mary and Consolata, we pay everybody. Primary health care, level 2, level 3, and sub-county hospital, under PHC, we have paid 9.8 billion, 13 months. If I am given the list before I finish, if you give us right now, before I leave the house, Honorable Speaker, I will give the Honorable member how much we have paid those facilities. Just right.
Honorable members, we are now at 6:18. I have 4 questions to go from Honorable Karani, Kawanjiku, Naisula, and Kwenya. Kawanjiku has already had 2 bites. Minister, if I skip Kawanjiku, can you answer the remaining 3 questions in 30 minutes? Minister, if I skip Kawanjiku's question 77 for another day, he has asked 2 questions already. Can we do the remaining 3 from Karani, Honorable Kwenya, and Naisula in 30 minutes? We can. Yes, Kwenya, what's your suggestion?
Mr. Speaker, most of these questions that we have raised are interrelated, and actually,
completely, yes.
Based on the responses that we're getting from the Speaker, I would wish that maybe we read them out, all of us, then we can have responses from the CS. If we have further questions, then we can engage as we're doing.
Then even Kawanjiku will be in the net. Let's start. Stephen Karani, Minister, record all of them, and you'll answer them in 30 minutes.
Thank you, Mr. Speaker. I stand to ask question number 75 for 2025. Can the Cabinet Secretary explain why informal sector workers are no longer able to remit monthly contribution to the Social Health Insurance Fund SHIF and the Social Health Authority SHA including being required to make top-up contributions when they are receiving medical services from hospital, creating discrimination as this requirement is not imposed on salaried individuals. Number two, can the Cabinet Secretary
Order, Nabulindo and Oundo. This is not a market in your region.
And the Cabinet Secretary clarify whether any assessment has been undertaken on the impact of requiring annual contributions from informal sector workers on their right to access affordable health care. And finally, number three, outline the alternative payment models accessible to informal sector workers and measures put in place to ensure inclusivity and flexibility in the remittance of SHIF. I thank you, Mr. Speaker.
Could the Cabinet Secretary A provide a report on the number of Kenyans that have registered with the Social Health Authority, including measures taken by the Ministry to sensitize the public on payment of premiums and the benefits available under the package offered by the authority? Question 2, clarify on whether indigents are subjected to a means testing process, and if so, provide a report on whether claims by indigents have been fully paid for and the number of indigent households that have benefited under SHA. 3, outline the current uptake of premium financing and the utilization of the Lipa Pole Pole scheme under SHA for Kenyans in the informal sector. Number 4, provide the status of recruitment by the SHA and whether staff of the defunct National Health Insurance Fund, NHIF, have been transitioned to the authority. Number 4, indicate the status of the suspension and investigations of health facilities that had integrity issues, including actions taken by the ministry to resolve the matter and ensure accountability by the health facility. Number 5, clarify whether the Lulo and Urban Private Hospitals Associations, RUFA, allied facility are accepting and treating SHA members in their facility. Thank you, Honorable Speaker.
Naisula.
Thank you, Speaker. Could the Cabinet Secretary outline measures put in place to ensure the provision of quality healthcare services and patient safety in health facilities, including the manner in which pre-authorization for admission and procedures is done by the Social Health Authority? Clarify whether the Ministry of Health, the Social Health Authority, and the Kenya Medical Practitioners and Dentists Council conduct inspections of the contracted health facilities to ensure strategic purchasing of services and that SHA members receive quality healthcare services. State measures put in place to ensure availability of drugs in healthcare facilities by Kenya Medical Supplies Authority, including improving the institution's order fill rate and ensure uninterrupted supply of drugs. 4, explain the relationship between the Social Health Authority, the Digital Health Agency, and the Kenya Medical Practitioner and Dentist Council with regard to updating of bed capacity, empanelment, pre-authorization, claim settlements, system downtime, and surgical reviews. Explain why the Social Health Authority Tribunal has not been operationalized, and explain how disputes in relation to billing disputes, claim rejections, and closure of facilities are being handled by SHA, KMPDPC, and the Ministry. Clarify whether Kenyans may seek medical services outside Kenya under the Social Health Insurance Fund, and if so, provide the procedures that are to be followed for getting approvals to be treated outside of the country by the Social Health Authority. Lastly, Mr. Speaker, can the Cabinet Secretary provide a report on the manner which the Social Health Authority empanels and pays health facilities outside of Kenya? Thank you, Mr. Speaker.
Kenya.
Could the Cabinet Secretary explain what entails the Linda Jamii program, including whether there are any benefits categorized for maternal, newborn, and child health? Provide report on the statistics of teenage mothers and their children being treated at the Social Health Authority. State how much has been paid to facilities by the Social Health Authority at the Public Officers Medical Scheme Fund, including how much has been paid to the fund by the Ministry of Public Service. Outline the current status of NHIF outstanding, that is defunct NHIF outstanding debts, and the verification of the outstanding claims. Provide the reasons or grounds upon which SHA rejects claims, including whether such reasons are provided to health facilities, and the measures put in place to ensure that the 9,000 contracted health facilities are trained on claims, processing, SHA digital systems, and financial accountability. State whether SHA is paying for emergency services provided to Kenyans, and if so, explain how are the ambulances contracted by SHA, including procedures for referrals where ambulances are involved. Indicate the level of ambulance coverage in rural and far-flung areas of the country. Explain how the ministry is engaging and supporting county governments in the implementation of the Facility Improvement Financing Act, that's CAP 277. State the measures put in place to ensure that county laws are aligned to the national legal framework on facility improvement financing, and finally, outline the steps taken by the ministry to regulate organ and tissue donation and transplant in the country. Thank you, Mr. Speaker.
Minister, all those questions are largely overlapping, some touching on issues we have already dealt with. Could you cover them in the next 20, 30 minutes maximum?
Thank you, Mr. Speaker. Mr. Speaker, I also have a very comprehensive answer, which I have given to members. They can look at it, and I'm ready to engage them further. Honorable Karani was talking about why the informal sector and SHA, Lipa Pole Pole. I think all that together, if you put it, it tells you that the mean testing is working. And up to today, 1.8 million informal sector contributors have successfully registered, nearly doubling the previous annual enrollment rate of 51,000 individuals who are now actively. Every evening, 2,000 to 3,000 Kenyans go through the SHA Lipa Pole Pole, outside those others who pay through the informal sector, who go through the mean testing. Honorable Speaker, Honorable Kawanjiko is asking the same question I also answered earlier. How many Kenyans are registered as of 3rd of November?
Yes, Robert, what's your point of order?
Mr. Speaker, I've heard the CS allude to the issue of Lipa Pole Pole. Mr. Speaker, isn't it a fact that now anyone in the informal sector is supposed to pay annually upfront? That Lipa Pole Pole system was actually scrapped. Maybe he needs to clarify, Mr. Speaker.
Okay.
No, I think SHA Lipa Pole Pole is annual contribution. Honorable Mbui, I'll tell you, if you listen, I'll tell you. SHA Lipa Pole Pole means, first, there are Kenyans who pay through the informal sector who go through the mean testing, they pay annually. Now, when you go through the mean testing, and your contribution is, for example, annually 6,000, and you don't have money, then SHA Lipa Pole Pole kicks in. It asks you, you pay 4 months. And the balance 8 months, you now use SHA Lipa Pole Pole. Will you pay daily, weekly, monthly? And then you, let me finish. Because unless you go through the mean testing, when you go through mean testing as an informal Kenyan, for example, Boda Boda, it tells you your annual payment is 7,200, for example, and you have only money for 4 months, okay? You pay the 4 months, then it gives you a guarantee. There's no tax interest, there's no levies, there are no taxes. It pays for you the 8 months. Once it guarantees you to pay the 8 months, then the next question it is, do you want to pay the 8 months on a daily basis, on a weekly basis, on a monthly basis? If you say, for example, weekly, every Friday you'll get a text message on your phone telling you you are to pay 100 shilling, for example. If you don't pay, then the next week it will tell you you have to pay 200. And Mr. Speaker, as of today, 1.8 million Kenyans in 13 months have paid their annual contribution from the informal sector. Honorable Speaker, just to move, but my 25 minutes will be over. Okay, no problem.
Naisula.
Thank you, Speaker. On the issue of Lipa Pole Pole and a lot of other matters on SHA and payment, Mr. Speaker, and with our interaction with our constituents, they do not have the information. And there's a lot of confusion. Today, there's this circular, this policy, people are getting a bit confused. So if maybe there would be better channels of communications and to reach everybody. So whether it's the local radio stations or whatever, run programs where Kenyans can understand, because I can assure you, if as a member of parliament, sometimes I'm a bit confused. You can imagine someone in the informal sector understanding what is Lipa Pole Pole, Lipa Annual. You cannot be treated before you do the annual. I just think it's the communication aspect of it that Kenyans are having a challenge with the whole payment issue.
Yes, Milemba.
Thank you for this question. And here, CS, we really must help Kenyans. It's not a win or lose situation. The Lipa Pole Pole is not working. Yesterday, a widow in my own constituency at Muhaya hospital and a desperate person could not get SHA. And we tried all efforts to see whether the Lipa Pole Pole could work. It's not working, they said no. So we ended up paying 7,800, which I paid myself, and I have a message here. If we fixed Lipa Pole Pole, it would really help Kenyans. So when we are dealing with this particular one, we must not win out of an argument, but just go to the real issues that let's make the Lipa Pole Pole work. We shall be happy and you will be happy. Thank you, Honorable Speaker.
Minister.
Honorable Speaker, I want to go on record. Every night at 10 p.m., myself and the leadership, including the President, we receive updates of how many Kenyans register with the Social Health Authority. Last night, and I can table it, over 2,000 Kenyans across the country went through SHA Lipa Pole Pole and paid money close to 5.1 million shilling. Every night, and I can give this House the whole data for the last 6 months. I was a cabinet secretary. It's working, and it's very popular, and it is going to make the social health insurance fund sustainable. 2, I agree with my sister, 13 months. Even as leaders, on your Twitter, Honorable Lesuda, I will send you. And I told you, you are one of the people. It is not rocket science. You went to the vernacular. And I want every leader, myself, I'll go to the vernacular. It is not only the healthcare of all Kenyans. We will provide, I will go to all the vernacular myself. I have done it on social influencers, very key. This is something we must sell. In fact, the most important element why we introduced social health insurance was to make sure NHIF was more of a club. It was for the salaried people. And that is why our speaker today is paying 46,000 and members are paying close to 32,000.
No, I pay 58,000.
Yes, he pays 58,000 so that those who are going through the mean testing can be covered and healthcare becomes accessible. Honorable Speaker, the last time I was here, you told me 46.
I pay 50,
I think now you need to look at it.
I pay 58,700.
And I am ready, Honorable Speaker, to come to a Kamkunji and take members through SHA Lipa Pole Pole. But I agree, I want to look for the vernacular sessions based on different regions, bring them together and take them through this SHA Lipa Pole Pole. But it's working. Many Kenyans have gone through it. And that's why today we have Honorable Member for
Minister, to be on the safe side, say it is working, but it's work in progress.
Yes. The whole of SHA, Your Honorable Speaker, yes. The whole of SHA is 13 months old. The system is 8 months old. So let us not treat it. This baby is just walking. And we are getting very good feedback from leaders, and we will keep on improving. A good example, Honorable Speaker, that Honorable Milemba asked me, we have 440 facilities in counties, and we have written to COG, that have no bank accounts. So if you have facilities that their bank accounts are not with the SHA, we will not pay them, but we have their money. No, we are checking US. If they have no bank accounts, then we will not pay, but we have the money, Honorable Speaker. And we have told him to give us the list. Honorable Speaker, there's a member who asked us about the donors, the indigents. I have provided the list from UHNCR. Murang'a County had the highest, Kasipul, Laikipia East, Nakuru East, Kikuyu constituency, Langata, Rana Motors,
Murang'a County has the highest indigents.
Highest number of indigents that they have paid for, 37,000.
What about Turkana?
Turkana has not paid for. Okay. But there are a number of counties that have committed, including Kajiado, including Vihiga, including Kakamega, the ones we have. And we do a rollout of SHA. A number of governors, a number of members of parliament have committed. Honorable Speaker, the legal framework and transition of former NHIF staff, we have agreed. It is this House that has reduced the administrative cost of SHA from 18% of their budget to 5%. And because of technology, the staff also was reduced from 1,800 to 800, close to about 900. Those who will be observed through competitive recruitment to SHA, we have done it and we are continuing. Those who have not, they will be placed in other public institutions at the same salary, at the same scale. So that because they have mortgage, they have other commitments, they don't lose it. That commitment, I have made it. Last time when I was here, I tabled the letter from Head of Public Service and from Public Service Commission. And the number of people we have employed from the Chief Executive Officer, Dr. Mwangangi, to all the directors, to the deputy directors, to the assistant directors, we have employed close to 65 and we keep on. On enforcement, I've said fraud detection and claims rejection, close to 10.6 billion have been rejected in fraudulent claims. We have regulatory facility closure. KMPDC has the powers to register, to upgrade, to downgrade, to close as a regulator, and it has revoked the license of 454 facilities, and it has closed 546 premises. And all this is because of non-compliance. They claim to have a theater, and they don't have a theater. SHA has also suspended a total of 85 facilities for fraudulent activities. We have submitted a number of files, I have said earlier, to the DCI, and the ministry has also submitted 1,180 files for further interrogation to the criminal justice system. Status of prosecution by the ODPP as of 4th of October, a number of people, both staff and facility owners, have been taken to court. Honorable Speaker, on the rural urban private RUFA, allied facilities, Honorable Speaker, let me make it very clear that facilities are the ones who sign contracts obligation with the SHA. Bodies that represent, there is a Kenya Private Healthcare Federation, there is RUFA. All that they can do is to lobby for their members. They have absolutely no construction obligation on SHA. Every facility will engage with the Social Health Authority and its leadership through the contract they have signed. But we do active engagement, we do structured dialogue, and we do operational support. And we, as we said, we empaneled close to 10,540 facilities across the country. Honorable Speaker, the ministry is implementing a very comprehensive measures to ensure that the provision of quality health care and patient safety are there too. And we are doing that through making sure that we do an oversight on all facilities and their compliance. We deal with anti-fraud measures. Our digital system, AI-powered fraud engine, eliminates fraudulent practices like upcoding, phantom billing, falsification of records, and all these will compromise if we allow the financial sustainability required for quality health care of our citizens. Honorable Speaker, there was a question on whether the Ministry of Health, SHA, KMPDC conduct inspection. Yes. Kenya Medical Practitioners and Dentists Council and the Clinical Officers Council are the designated licensing authorities mandated by law. They evaluate service readiness, they ensure compliance with the facility, they conduct site inspection on new facilities, they check the location, the infrastructure, the service, and the human resource. The role of SHA is just contingent upon the regulatory body's licensing status. SHA utilizes DHA, the Digital Health Agency, digital system, and its forensic audit, just to monitor claims and then use the same system to suspend the various facilities, like the 85, because of fraudulent activity. SHA new computation model for PHC, Honorable Speaker, promotes very strategic purchasing. Honorable Speaker, on the measures to ensure availability of drugs, which is very, very important by KEMSA. Honorable Speaker, KEMSA, in line with mandate under the KEMSA Act and the UHC agenda, we are doing a number of reforms to make sure that the authority fill rate, which is now at 67%, goes up to 90% by the end of the year, so that drugs are available in each and every facility, more so public facility. And this we have agreed with the Cabinet and the Council of Governors to make sure that KEMSA is not known for the COVID billionaires. KEMSA will be the KEMSA that will serve each and every Kenyan at his village and next facility. And we are doing this through a number of reforms which I've stated in the documents that I will present. I've just presented. On, yes, there is a table between that I have given responsible agency and their role distinction. KMPDC, SHA, and all that is provided. Handling of the dispute tribunal. Honorable Suda, I think that dispute tribunal ideally is supposed to serve as an independent body for appeals against SHA decision. We have developed ourselves the required rules, the Social Health Insurance Tribunal procedure and the rules, but this tribunal has not appointed due to government plan and most of the judiciary that says all tribunals under the judiciary should be under a new bill, Tribunal Bill 2023, which is before the House. Once that is complete, then the tribunal, appeals tribunal of SHA will kick in. But for us as a ministry, we are ready, we are willing, we are committed, and we have put everything in place in terms of procedure and rules. Honorable Speaker, on whether Kenyans seeking medical service outside, yes. There was a lot of corruption also in this area. There was something going on between certain healthcare workers and hospitals in some parts of the world, where Kenyans were being referred to when they can get the same services in our country. Today, Honorable Speaker, we have done for the first time 54 Kenyans got who could not hear, who could not speak, who could not talk. Young children, Codler implant was done at Kenyatta. 54 of them, and 10 was done in MTRH. This is one of the treatment that Kenyans who are going abroad. We have the expertise, we have the doctors, we have the specialists. So we have said there are only 37 treatments that if you want to use the resources of SHA, that you can go out. The rest, you must be at home. You know what happened during the COVID, Honorable Speaker, in India? where many Kenyans died and the bodies could not come back. And Honorable Speaker, we want to turn our country. Our hospitals, both private, public, and faith-based, are the best in the region. So we must make sure that not only our foreigners who come for medical tourism, but even our own people. On Linda Mama, defunct Linda Mama and Linda Jamii, Honorable Kenya, I have given a table. For Linda Mama, it was only maternity only. But for Linda Jamii, it's full household health cover. Pregnant women and newborns was only covered under Linda Mama, which was also budgeted here. Sometimes it was a victim of supplementary. In fact, by the time we were doing SHA, Linda Mama had a debt of a pending bill of 4.9 billion. Linda Jamii deals with all vulnerable mothers, spouses, and the children. It gives full range of service under SHA funds, whether it is PHC, whether it is SHIF, whether it is ECCIF. It's fully covered. It covers the whole family, and it gives full insurance coverage. But Linda Mama was only restricted to maternity, limited to the mother and the child, and I have given all these services. Under maternity, SHIF covers normal delivery 10,000, C-section 30,000. For Linda Mama, the defunct, it was about 5,000, and it was paying different figures for different facilities. Public health facilities, they were being paid 3,000. Private, Linda Mama was paying 5,500. Faith-based, they were being paid, I think, 4,900. So the primary health care fund provides free treatment for all common diseases. Honorable Speaker, the other question was how much has been paid to facilities by SHA under the Public Officers Medical Scheme. This is very important, Honorable Speaker. The Ministry has developed a new working arrangement to sustain Public Officers Medical Scheme Fund, guaranteeing that service remain accessible, provide budgetary allocation through this house, which are made available. So far, SHA has received from the Ministry of Public Service 4.1 billion. And this is for this Public Officers Medical Scheme Fund. The amount paid to facilities, SHA has already paid out of that 2.4 billion to facilities under the scheme. Outlining the current status of NHIF outstanding debts, I think that, Honorable Speaker, I have answered it very comprehensively. And I think the only last question is state whether SHA is paying for emergency service provided to Kenyans, and if so, explain how the ambulance system work by Honorable Kenya. The Honorable Speaker, payment for emergency service. Emergency treatment is covered under the Emergency Chronic and Critical Illness Fund and is accessible to all Kenyans, regardless of registration or premium payment status. So emergency treatment service is, again, like PHC, is free and no Kenyan will be denied. So emergency care is provided for up to 24 hours. On the ambulance contracting and referrals, the benefit package says SHA is rolling out an ambulance evacuation service benefit package under the ECCIF fund that the House has created. The tariff structure is 4,500 for within 25 kilometers. So if an ambulance picks you from point A to the nearby facility, SHA will pay 4,500. Outside 25 kilometers, 75 per kilometer for extra kilometer service. We are contracting both county and private ambulances, and this will be just like the way Uber runs. Our command center, you call it, they will tell the nearest ambulance to come to you, pick you, take you to hospital, SHA pays the money, and the first 24 hours, all the treatment, whether it is surgical, will be paid by the Social Health Authority. So it's free. And I think the Kenya Medical Practitioners and Dentists Council, the regulator, has put the adverts, and Honorable Kenya, as a businessman, you can also invest in the ambulance. But the standard is very high. The standard is very, very, very high. Honorable Speaker, the SHA board is in the process of implementing a nationwide ambulance service across all our 47 counties, designed to complement the efforts of our county governments. Finally, Honorable Speaker, the last question is to explain how the ministry is engaging and supporting county governments in the implementation of the Facility Improvement Act, CAP 2022. Honorable Speaker, this Facility Improvement Financing Act requires all public health facilities, level 2 to level 5, to establish structures for collection, retention, and management of revenue from health services. And this aim is to improve local facility operations. The money should not pass through the county treasury. It should go directly to the facility. They can buy drugs, they can hire healthcare workers on locum, they can improve on the facility. But Honorable Speaker, we need to engage. The Committee of Health of the National Assembly has gone around the country during recess, and they have found out a number of issues. One of them is counties having their own FIF legal regime. And I want to make it very clear through you, Honorable Speaker, if you allow me, that national legislation always supersedes county assembly legislation. So there's no way you can use the county assembly law to undermine the law passed by this house. And this must be very, very clear. If you do that, then you contravene the law. But the operation of SHA inherently supports FIF implementation by making sure there is a cash flow to these facilities. The capitation and the claims payments directed to the fund will help them manage their funds locally. We'll also streamline their ordering way so that SHA and KEMSA are now ordering directly from the facilities. And then there is alignment of the laws. The ministry defers the detailed updates of alignment to our county laws, to the Council of Governors. We have discussed and they are looking at it. Honorable Speaker, I have a very detailed report which I can table for members to look at it. And if there's anything...
Indeed, members, each of you, there is a very detailed response to your questions. If you haven't received yet, you can pick from the table office. Chair, Health.
Thank you, Mr. Speaker. Let me start by appreciating the Cabinet Secretary for the detailed report he has given, which to a large extent is actually correct. In terms of design and intention, the ministry is doing a fantastic job. And I think the only issue that is coming is actually when you go on the ground on implication, there are areas that there are still gaps. We have discussed this with them, and as you can say, and I'll mention just a few, but that is the basic thing. It is like the issue...
do it in 3 minutes.
3.5. So, in the issue of registration, that SHA pole is a problem to people. And if it can be done, it will make things work much better. 2, in the area of benefit package, again, there is a problem there, and the minister says rightly that it passed through Parliament, but it passes as delegated legislation, which means if it goes through, then it doesn't really come through the committee, and we have acted with them. We will actually have to look at the benefit package and the tariffs. And like the case of Honorable Oundo and Honorable KIBANGENDI, it's extremely simple what's happening there. Honorable KIBANGENDI's mother had diabetes, which was the basic problem. And that basic treatment was for diabetes. But then she had a wound in the foot because of diabetes and I think a toe. So the diabetes had to be treated and then the surgery done and I think the toe amputated. Now, the benefit package looked at the surgery and paid for the surgery, but not the treatment of diabetes. So these are the areas we really need to look at. So if you look at then the primary care, again, very quickly, and I'll ask members, please go to our health centers and dispense level 2s and level 3s and even level 4 outpatient. Ask patients, Are you getting treatment and coming out without paying? Because this is what, as a committee, we actually did and will give back. And the FIF, Mr. Speaker, the minister is right that it is in law, but we have looked at that and there's already a proposal from our committee on how to look at that and remove the power from the counties of varying it. So what we are really, and cancer, for example, what is happening? There was 400,000, but when ACCFI came, the emergency and chronic care, they added 150,000, make it 550. But what is happening, there's a difference between the package and the tariff. So if these patients are getting chemotherapy, it's something about 84 to 100,000, and they're getting 10 to 12. It is already above 550. So these are really the issues that we are having. So I think the ministry is doing well. We'll work with the committee. The committee will work with them and really get the details. The issue of claims and rejection of claims, again, issue of communication. What Honorable Jalango said is so key from what we saw in the ground, Honorable Minister. We need a big communication strategy to go out to the level, almost like we campaigned for the Constitution. I think if we do that, we'll get it right. I didn't want to say more because we'll give a report to this House that actually covers virtually all the areas that we have done here, Mr. Speaker. Thank you very much. But SHA can work if we look at it carefully, we leave out politics and try to control business, it will work.
Thank you, Chairman. We'll end there on questions. Minister, you are released with your team. Call out order number 12.